Hi, everybody. We're so excited to have Rhonda McEwen to talk to us today. Rhonda is most importantly a faculty affiliate here at Schwartz Reisman, which is awesome. But she's also many other things, Canada Research Chair in Tactile Interfaces, Communication and Cognition, an Associate Professor of New Media and Communication at UTM, and she is the Director of the Institute of Communication, Culture, Information and Technology. I think that's a longer title than our institute here, Rhonda. And she has an MBA in IT from City University in London, England. Somebody needs to mute. Okay, Peter, I'm muting you. I'm muting people. There we go. Did I do it? Yes. Okay. It's the great power of the host. Okay. So MBA in IT from City University in London, England, MSc in Telecommunications from University of Colorado, and a PhD in Information from our own University of Toronto. Combines communication studies applied in behavioral sciences to examine social and cognitive effects of technologies, and pioneering approaches to communication research employ experimental techniques, eye tracking, observations, sensor data, and interviews to investigate human-machine communication involving children and adults across the user spectrum. Rhonda was also just appointed a special advisor on anti-racism and equity at UTM, which she notes means that she gets to give advice, but does not have to run the meetings or come up with the policies. So I think that's the best of all worlds. Okay, so we're very much looking forward to this talk, Rhonda, and I'll let you just get started.
Thanks so much, Jillian, and thanks to everyone who came today. So I just want to first shout out some people who are working with me on this project. So Zhao Zhao, who might be on with us right now, is a postdoctoral fellow with me at UTM. Hi, Zhao. And also at KMDI Semaphore Labs. And Zhao is probably the person I like to attribute as the brainchild behind this project. So it's nice to have her with us. Yassi is my doctoral student who's is a doctoral student at the Faculty of Information. And Tony Tang is also working with me, and the four of us together applied for one of the COVID grants that U of T gave out earlier this year, and were successful. So what we're sharing with you is sort of work in progress. So it's early, so I didn't send out a paper, mainly because our first paper is currently in review. So I'll tell you about that one. We have another one we're running for a November 1st deadline for. And then we have one last part of the project. So we've been very busy working on this. And so it's our pleasure to talk to you today about digital technologies and Chinese interpersonal communication on the mainland and in the diaspora, the case of COVID-19. So I like to say when I'm telling people about the project that this is a story about making lemonade. Zhao and I had designed an entire research project around human-robot interaction, mainly looking at trust in HRI, human-robot interaction. Very influenced, of course, by someone on this call, Brian Cantrell-Smith, who talks about trust and judgment, and in his new book, The Promise of AI, Reckoning and Judgment. There are quite a lot of the themes that we're interested in emerge from that work. So thank you, Brian. But of course, as we were submitting our ethics, down came COVID-19 pandemic. And so we had to make some lemonade. So basically what we decided to do was, and the new word, apparently the new sexy word for all of this is pivot. So we decided to pivot our research and try to use some of the same things that I'd been thinking about, but no, we couldn't go into the lab to do the experimental work that we had planned, where we were going to use sensors on people, attached to people, as they interacted with both robots and with social robots and with human beings, and to look at some of the ways that the body responds when interacting with these two different kinds of interlocutors, if you will. So what we did instead is move some of the ideas that I had been playing with And so I just want to give you a little historical backdrop. When Jillian introduced me, she talked about my master's in telecom engineering from the University of Colorado. From there, I went on to work in management consulting for mobile technologies, and I did that for a number of years. And the area I worked in the most was on context-aware computing, which became known in many ways as ubiquitous computing back in the day. So this is sort of, you know, late 90s, early 2000s, where, but mobile media as a sort of technology had been playing with the idea of context for decades. A simple example of how that manifested itself is when you have a handover between a Wi-Fi network inside of a building into the wider area networks, the mobile networks outside of a building. So handing over from Wi-Fi into you know, mobile telephony, cellular networks was one way mobile devices started playing with this idea of context awareness, knowing basically the user's location and the user's state and surroundings to modify how the technology would work. So these ideas around context awareness really became a primary part of my focus, and it sort of percolates through a lot of my work. And so as we talk about the project, I want you to kind of keep in the back of your mind this idea of context awareness that sort of came to us through mobile media, which is defined mainly around location awareness, but really ought to go further than that. And this idea that context awareness as a term and its origins in ubiquitous computing, or what became known as pervasive computing, which tries to deal with linking changes in the environment with computer systems which are otherwise static, and see the world, you know, as a snapshot and not as a video that keeps evolving. So basically this idea that design, implementation, and evaluation of wearable systems that can learn context-dependent personal preferences by identifying individual user states and observing how a user interacts with the system in these states. So that's kind of the fundamentals and the origins of ubiquitous computing, pervasive computing, that is starting to now port itself towards human-robot interaction and this idea of intelligence and the ability to flexibly change given an environmental change. So this is sort of how I'm actually trying to make some connections to the talks that have gone before. Now, in terms of conceptual influences, I talked about Brian's work. Also, I've always been deeply affected and in my research by Lucy Sushman's work. I mean, I'm teaching undergrads, and I feel sorry for the poor second years who have to read, you know, drop them into the middle of a chapter in Lucy's book here, and they're reading that. But I'm going to hark back to earlier work, sort of the work she did in the end of the 80s, where she spoke about, in her book, Plans on Situated Action. And in one small piece of quote here, which I think works nicely with what I'm talking about, is this idea that human cognition is situated in the social and in the physical context. And we people use our cognitive representation of a situation in the way we act and in the way we interact. So this idea here, or to basically simplify that communication, which is fundamentally the area I'm working in, is, and if we think about context awareness, we can't think of context in the terms of location only. So in those early mobile media days, understanding the transition across different kinds of networks is one kind of context. But as we go into the idea of intelligent machines and AI, the idea of really understanding conceptual framing to understand cognitive architectures and how people make semantic and other representations of the world that we live in demands a lot more of the system than simply knowing when to switch on your Wi-Fi, or you know, the magic of when Google Maps knows that I'm headed to work and tells me the traffic along the way without me saying so. So it's not just about learning what our habits are, but also learning when things don't go according to plan and being able to adapt to those new scenarios. So another piece of that I could think of as a conceptual influence would be Hoffman and Woods, who put it this way: machines do not know that they are in the world that they have within themselves as a model of that world. So really playing with this idea that we build in some kind of awareness of a model, or some kind of semantic architecture of a model within the machine, but the machine cannot contextualize themselves inside of that model. That's already from which they operate. So to even go further to consider context and being context flexible becomes even more difficult if you can't even baseline your own position within the system. Speaking of systems, my last influence is always around systems theory or systems thinking. And here I really am moved, and I am changed, and I'm a practitioner of thinking about the whole, stepping back from micro studies, and I do a lot of micro studies, but to always think about how these micro studies, how what I'm seeing in this small, how it evolves out, and looking at something as a whole system. And so again, this plays nicely into the idea of context and context awareness, because for me, context awareness is that larger systemic view. So if I'm interested in things like trust and machines, trust in communicating with machines, I'm very therefore interested in thinking about the entire system that includes not just the technology, but also the human and the cognitive within that human. So thinking of these nestings. So I was trying to connect into this sort of all the talks we've had so far, which have been focused on AI. And the way to maybe make a connection here and a linkage is to say, if AI is increasingly powering our everyday surface, or we're interested in introducing AI to power our everyday devices and services, such as, you know, personal voice assistants. If I even use the word ALEXA, it'll go off in my house, for example, movie recommendation services, whatever, driving assistance, as I've talked about. So while AI has become and is becoming more sophisticated, when we see the glitches, when we see the faults and the problems and the weird returns on statements, we sometimes will ask ourselves, like, why did this happen? Why did we get this? And you know, it takes some trial and error, and we can probably get ourselves back to where we were headed if we were interrogating a machine for an answer. But we never completely regain a full trust in our AI-powered machines and our communicative partners. So some of what I'm talking about here is about, again, connecting all the things we've been hearing about AI so far in the other seminar series talks, and really trying to take it in a slightly different direction. So I'm going to describe for you our research project. And I have an epistemological leaning toward user interaction studies as a small start that helps me then expand out. And you'll see as I describe this project how I go about doing that. So the idea here is that contextual AI is not necessarily referring to a specific algorithm or machine learning method. For me, it's much more of a human-centric, or if you will, a sort of humanly centric view and approach to AI. And at the core is basically trying to define sort of what are the requirements that we're headed towards, and whether or not those are things we should be actually headed towards, and really questioning whether the machines can deliver on this. And at the end, I'll say, or I could say now, that, you know, after maybe 3 decades or more of working in mobile media within this goal of context awareness, we've moved the needle only very little. And so as we start thinking about context awareness in the frame of machines and robots and things like that, I have my own queries about whether we are just repeating the same tropes that we have from another set of technologies coming up again. So let's get into the project itself. So as I said, in May 2020, we were awarded a COVID-19 grant by the University of Toronto And we decided, and Zhao was really the brainchild behind this. In her own networks, Zhao is from China, and in her own networks, she was hearing during the sort of early time of the pandemic about different ways that people and technology were interacting during the lockdown and the stay-at-home orders and the quarantine period. So we were interested in seeing how one country that was tracking ahead of another, so Canada tracking behind China as the pandemic is being experienced, what were some of the themes that were arising in China? And as things would emerge, what we could see was happening in Canada, and try and see, not specifically comparisons. Sometimes we make comparisons, sometimes we don't, where it's relevant. But thinking of the sort of the pandemic as a macro context. So if we're thinking about context again, the pandemic provides a sort of very unique, once in hopefully a lifetime experiences that really helps us to interrogate some of these fissures, if you will, in human-machine communication. So we have 3 themes to share with you today. The first is around children and technology. This is an area I've done quite a lot of research on, mostly in the area of tablet interaction and apps on mobile devices. So looking at children and technology, examining the health code, which is a very specific instantiation that's happening in China. And then a third theme emerged in our data collection around online education. So if the overall theme then, the macro context is the pandemic, we're gonna now drill down into some of these thematic areas. And if people have questions, I'm not actually looking to manage my screen. I won't see your hands. So if Jack or Jillian can let me know if there are any hands raised, or if people just want to jump in, please do.
I'll do that.
Thank you. So let's start with what were we trying to kind of get at with the project. We know that digital technologies are integrally involved in not just the messaging of COVID-19 pandemic data, but also in the control, or as many governments and policymakers were calling it, the fight in COVID-19 to keep people connected, updated, and safe. So this is sort of the rhetoric that comes out. One of our questions, therefore, was sort of how did technology impact people's daily life during the outbreak of the coronavirus in China? So that sort of was our starting point. We were interested in China as a case study to, as I say, look at how people were handling it. One, we know that the Chinese did have the heaviest effects first, and the rest of the world sort of looked on to see what was happening. We saw and heard about the uses of public policy, policing, law enforcement, public messaging, the use of mobile applications and mobile devices as platforms to basically police, control, and to share information about the pandemic and about people's movement. So we're really interested in looking at that. We also had as a question, were the experiences universally similar, or were there differential effects of staying sheltered at home and moving inside and online? And that would include, we didn't know at the time, so we just put these out as feelers, people who were older versus younger, younger, healthy, people who were medically challenged, affluent, and those who were had socioeconomic disadvantages. So we're interested in looking at how these changes in daily life and how technologies were being used was affecting the population in similar or different ways. And finally, we went into the project with the idea of what are the communication and media use lessons that we could see from those first affected by the pandemic. And then as time goes on, we're now starting to do some of the comparisons with Canadians, but in particular in Ontario. So this became sort of the grounds for lots of ideology around COVID and around how governments, 2 very different kinds of government structures, were managing and handling the pandemic, or mismanaging and handling the pandemic. issues around culture, communicative differences, and so on that we were interested in seeing. I'm a big poo-hooer about these ideas of cultural differences. I have a real issue with that. So my team probably smiling right now because when we first talked about theoretical underpinnings, I totally dismissed it. So we'll see whether or not I was right or wrong as we go. So what do? We started, and the royal we here is that we have done 85 interviews, all remotely. And we had a record turnaround on ethics. I think we got our ethics cleared in 7 days or something. So we hit the ground really quickly. So we have, along with 2 other research assistants, Zhao and Yasi have done all our interviewing, which is 85. 75 of those interviews are in Mandarin. All the coding, the thematic analysis is under sort of Zhao's direction, but the team's done phenomenally well. Since Tony and I do not read Mandarin, we have weekly meetings with the team to go through the findings and to help with the data analysis. So that continues to this week. And as we tease out the themes, and those are the 3 themes that I shared with you earlier, children and technology, the health code, and thinking about online education, began to emerge as interesting topics from the interviews. So we started we started with a more general interview that then started to get more and more specific, and then follow-up interviews on these themes that started to arise. So let's talk about theme 1. And so I talked about the macro context of the pandemic. Now let's talk about a more micro context. And I talk about micro context changes. And this one is classroom to the home. So when the pandemic struck in China, the stay-at-home orders went into effect. Even as time passed and the months passed, the younger children, elementary school children, remained at home. So this is one difference that will come out more in our next piece, but where we talk about online education. But in China, they made the decision that elementary school children would stay at home, which is a really interesting difference in how Ontario is implementing, just as an aside, where we, in our case, elementary school children are going out 5 days a week, and our high schoolers are actually on a hybrid at home online kind of arrangement. But so we have this situation where all the younger children went from a classroom to home. And one of the questions we asked was, how did children use different technologies during the pandemic? 2 things came to the fore from this questioning. The first was around smartwatches. And children's smartwatches are a particular phenomenon that is taking off. It's very popular in China. We noticed that children were relying very heavily on technologies to stay connected and entertained while they were home during the pandemic. And since parents were often home as well, or grandparents, it was a way to keep the children occupied while they had other things going on. So in China, children, so elementary school children, it's highly discouraged that they have cell phones. It is not popular at all. In fact, the guidelines even sound quite strict with recommending that children not use cell phones. So the smartwatches have kind of risen as a technology that children are able to use, and they do use quite extensively. So that's a paper we've just submitted to CHI, which is Computer-Human Interaction, IEEE SIG. So that one's under review. The second paper we're working on right now is around the AI robots that have been used by children during the pandemic. And Zhao that's our one coming up. So we're in progress of writing that one, but if you have questions, we could probably give you a few of the answers from our data collection so far. So let's talk about the wearables for children in the form of these smartwatches. Smartwatches are quite inexpensive. Most children in China between sort of 4 and 13, as I said, don't own a smartphone, but they have instead about 95% penetration in the children smartwatch or wearable market in China. And this is mainly in the urban areas in China. So very high, 85% percent of children in urban areas actually own and use a smartwatch. They are simple. They're not as expensive as the wearables we come to know. So they're much less expensive than a Fitbit, but they have way more features. So they have many features. And in this image, 2 children are actually, they're actually taking a selfie. So the smartwatch has, you know, picture taking capabilities. So they're actually doing a selfie with their smartwatch. One of the things we started noticing right away is that there's this dual user model. So in terms of a system, that this isn't about children and having a phone much in the way a child would have, you know, own a specific thing, and that would be the child's. And so we started looking at how the pandemic pushed this idea of who the user actually is of the system. So it's called the child smartwatch. It's called children's smartwatch. But basically, there are 2 components to the system. There is the adult user, the parent usually, or the caregiver, and they have access to an app that allows them to interact with the actual smartphone system. And then we have the watch itself with apps embedded on it that the children use. And this would include things like fitness games, radios, their social messaging systems, voice chatbots, cameras, as I said, a dictionary. It uses near field communication for certain kinds of games and activities, and so on. Then we have, so that's at the top here of the image. Then we have the middle part of the image here, where we have the features that are unique to both the parent and the child user. So that would be things like a payment systems to purchase things that's tied to an account, activity trackers, media players, reminders and alarms, the phone, etc. And then we have this one here in the middle, classroom mode, which you can toggle to basically, the parent can toggle this on that would remove access to some of the more fun and engaging apps on the watch so that children focus in the classroom. Then we have these parts here that are just for the parent. It includes a GPS system, a remote monitoring system, and a geofence, right? Which talks about a limit around which the child is able to move. Now, one of the things that I found quite fascinating is that people that, you know, even talking to Zhao and how their friends who use these systems and family members, this idea that they're making their children are safer. So it's really tied around the idea of safety. So a lot of the features on the parent app are around that location side, right? So that really context-aware applications that tend to come to the fore. And the child doesn't really control those apps, that's on the parent side, and so on. So we started looking at how the pandemic was changing needs versus wants. This idea of what is needed versus what we want during a pandemic. So here's a shift in the way we think about context. Context, not just in terms of the basic location stuff, that's all there, but context in terms of who the user actually is, and also what is needed and not needed given a shift that the pandemic has brought. So one of our research questions was how were they using it? Then which children's smartwatch features are sort of needs versus wants for dual users while they were at home during the pandemic, and then really focusing on COVID-19 effect on smartwatch use. So what we did in terms of a method, we interviewed 36 parent-child pairs. So we would interview the parent and the child to get their perspectives. And you know, it seemed to work quite well. I was worried in the beginning about children not responding appropriately or trying to answer the way the parent would want them to. But we actually did get some really good data, even when children were not happy with their parents. that came through. Perceived feature importance was something that kept coming up, where parents would say, well, before the pandemic, this is what I was really interested in. And since the pandemic, this is what I'm not interested in anymore. And sort of having difficulty shifting the device in the new context. We use the Kano model, and the Kano model helps us determine how people feel about product features, their satisfaction. So the model is based on certain premises that people's satisfaction with a product or a device or any kind of service depends on the level of functionality that was provided, how much or how well those are implemented, and that features can be classified into some groupings. So sort of what they call must be, which is like must have, things that you must have in your features, performance, the attractiveness of the feature, and feelings of indifference around the feature. So we use this Kano model to basically ask parents and then the children to get their unique user perspectives in this dual user model. And then we compared before versus after the pandemic. So this is going to be hard to see, so don't strain your eyes. And I'll just take you through a little bit here. In the Kano model, we see on the far left the parents, the middle are the children's responses, and then in the far right, we have our parents in blue and the children in orange, looking at how different features were put into different categories by the two groups. So here we see the feature, the model, and we noted that, following with the change from the pandemic, we saw shifting of the features. So the results indicated that there were 5 conflicting features from these two user groups. Classroom mode was 1, media player, which actually shows videos and so on. It's not quite YouTube, but that gives you a proxy. Games, social interaction with other people, other children, and remote monitoring, which is where parents can keep a track of their children using geo-trackers. So in terms of changes during COVID-19, on the left, we saw, this is the parents' change of preference on features during the pandemic and the children's change in preference during the pandemic. So here we have all the features that we looked at, and yellow, or the orange yellow, represents decreased preferences during COVID-19, and the sort of aqua color talks about increased preferences during COVID-19. And we can see some quite different perspectives. We can see, for example, that in the classroom mode, parents really wanted to keep that classroom mode. It was an increased preference during COVID-19. And remember, the classroom mode shuts down access to all of these other kind of gamified apps or entertainment apps. So it was interesting that one of the things I thought is that the classroom mode wouldn't really be relevant outside of the classroom, but what parents found is that it was even more important to them once they actually got these children home with these smartwatches. The fitness game, parents liked the fitness game a lot, and so did children. But here are some that were quite opposite things. The children did not like the classroom mode at all during the pandemic. So here we can see them almost wrestling with each other for control over the shared device now. Media player, of course, parents disliked it more during the pandemic while children were at home, and children actually liked having it a bit more than that. The voice chatbot was sort of equally used, but kind of increasingly interesting from the children. Social is a big one. Children really wanted to use their smartwatches to connect with peers. Parents, were a little mixed on this. I think it maybe was the amount of connection. The use of radio really was something that children didn't really enjoy. And phone calls increased greatly using the smartwatch for phone calls. So one of the things we say in our discussion is this context that talks about the user and understanding that the user is both the child and the parent. But one of the biggest things is that control, right? Control over the device actually began to become, for the first time, a major issue. With the child realizing, perhaps for the first time, that this isn't really my device, right? This was a device that is said to be mine, but when it comes down to it, when parents no longer need to do the geo-tracking because the children are at home, then really the benefits of the device is not as high for the parent, and the device became much more attractive to the child user. So the primary objective was no longer being met, or it was no longer needed by the parent, and it's what the children wanted to play with that became the sort of bone of contention. We talked about the features, and that communication became a key battleground that parents and children engage with over the smartphone. Parental monitoring is no longer a big deal because they have them at home, so there's really no need. But now that they've developed a practice of having it, taking it away becomes very difficult. And the smartwatch really moving into its own as an entertainment product versus a safety device. And so this became a huge challenge. One thing some of the parents talked about was following the pandemic, when it's back to school time, how easy and how quickly children and parents will flex back into a different arrangement around these kinds of devices. So as the pandemic ends, what happens to that dual user model again, where parents will want to even more so keep an eye on movement of children, where children have gotten used to using some of the other features of the device. So this kind of underlying assumption of who the owners are, and breaking the idea of consumer user as two different things, even after acquisition. Was there any question here? I heard some noise.
Yeah, I was curious. In the responses, it said that I noticed that the children were less interested in video playing on the phones. And I'm guessing that my hypothesis would be, well, they've got access to other ways of accessing media. Did you explore how other media, other technologies were displacing or interacting with the smartwatches, since the children were now at home much more?
Yeah, we did. In fact, the smartwatches only came up. We didn't pick the smartwatch as one to focus on. It came. We were asked. The question we asked was basically around all the different technologies being used, and smartwatch was the one that kept coming up on the top of the list. So then we started to deep dive on smartwatch. In terms of the other devices, more so than other media like television and so on, it's actually been the social robots, which is the second element that we're going to look at. So these kind of came up as the number one, number two kinds of uses for technology for children during the pandemic, which was really interesting. So in the absence of mobile phones, which we would probably see more here in North America in this age group, we see these other technologies taking the fore. TV access is a little bit more difficult. First of all, in many cases, given the setup of the household, it can be very difficult to have a TV running, even a tablet running while other people are trying to work and be in the same space. The smartwatch was small and sort of portable enough that you could kind of move it out of a space. So we started, I think that's why we're seeing that. But for sure, we see the smartwatch substituting for other larger household media, and an individual media taking the place. Thank you for that. Any other questions or comments? Okay, so I'm gonna just move on just now to theme 2 that rose from the data, which was around health code. I don't know how many people know about the health code, but so I can give you a little bit of background about it. The health code is basically the government of China has their implementation of contact tracing. And so the health code, and I'm putting this in the context of another micro context change of regulated public movement during the pandemic. The New York Times published a piece in August of this year. I think it was first published in March and then updated in August. And it was basically called "In Coronavirus Fight, China Gives Citizens a Color Code with Red Flags." So the subtext there says, a new system uses software to dictate quarantines and appears to send personal data to police in a troubling precedent for automated social control. So sort of exactly what Chinese officials would say that we would say in the West. So we were interested in finding out how people in China were experiencing the health code themselves, what their thoughts were, and really focusing a lot on the architectures that were being used here. So according to this article and in many other ways, we know that software on smartphones were dictating basically whether people should be in quarantine or not. And the health code, which is in this image here, is a QR code that is actually embedded in a very widespread app that's run by the same company as Alipay does, if anybody's familiar with that. But they allow people access onto subways, transit, malls, public spaces, grocery stores. So you basically have to show the software code on the system to allow you to enter these spaces. So you sign up on Alipay, you're assigned a color code, green, yellow, or red. So this is just a little quick image here with the green code indicating that you are allowed into a public space. So you show your phone with the code on it to gain access, or it scans to gain access. And we see people in figure 2 scanning into the QR code to exit or enter this bus and other kinds of spaces. And here an inspector is scanning someone in a mall. So it's actually around, it is the contact tracing app in China. It is mandatory that you have it. If you can't show the green code, you cannot move about freely, especially entering spaces where other people are. There are more than 1 billion users of the health code in China, and it builds itself, as I said, off of WeChat / Alipay. And WeChat is a very widespread, very predominant used social media platform. So I think I read somewhere that the analogy of the health code in our context would be something like the government using Facebook platform to basically run the contact tracing. And we know that there have been some discussions about how that could be implemented here. So the different ways of using the apps, you can have inspectors who could just come up and check on your exposure levels. Here you'd see people with green codes on the left would be allowed into public spaces. If you scan yellow, you must self-quarantine for 14 days. And that indicates that you might have exposure. And red basically means that you have to be in centralized quarantine. So apart from the QR code, the names and ID, so government official ID, verified ID is included on the screen, and the daily updates appear as well. So the way it works too is users should record their temperature every day in the app, and that keeps the code green. If you choose not to, or for some reason haven't updated, then it actually will not remain in green state. And that the information is then backed up and checked through the National Health Code System architecture, so that we actually have a way to verify. Let me see. Okay, so so David's asking, how would we compare the Chinese government use of the infrastructure to the Canadian government use of COVID alert? Well, glad you asked. we asked the same thing. So we're doing that right now. So I'll tell you about that. We couldn't pass up the opportunity to look at the COVID alert app. So, so just to look quickly at the architecture as a system, you can see here, there's a national ID verification platform. There's a health code service system that is accessing the app, the health code app. This is what's in the hands of the user. But within this entire system, there's confirmed databases with health information, close contact data, 14-day location tracking data, and other information from the provincial health code. There's scanning systems that are used outside the buses, entrances to markets, etc., and the app here on the user side. So this is an entire architecture that has been developed around the pandemic. So, and a little bit of history, the health code originally was provincial. So each province was independent in how they could use it. And then in April of this year, it became national. It became a national system. And that's one sneak peek at the differences with the COVID alert app that we have in Ontario. And I know that a couple of the other provinces are picking up on getting the COVID alert system. But when I did go to Quebec during the summer, I got the message saying you are now offline on COVID alert. So we are still in that sort of provincial independent state.
Rhonda,
So,
can I just ask?
yeah.
Can I just ask just about the testing regime? Are people required to be tested? So, like here, lots of people are not tested. Are you automatically green in that case? So, what's the testing regime behind this?
So it's connected to the contact tracing, right? So if you have come into contact with someone who if you are exposed, you have to get tested. The testing, it has changed over time in China. Initially, people would go to get tested. Now, and there was a lot of testing happening. Now, with the immediate 14-day quarantine that you go into, you can also have, and in the beginning, people weren't really allowed to move about at all, not even to get tested. That has changed somewhat. And Zhao, you can jump in here if you'd like, because you've been doing the more recent interviewing. But my understanding is that if you are exposed, you are not to go out among the population to get your testing done. Testing can come to you, and I think that's where we are. Zhao, did you want to jump in?
Yeah, sure. I think for those who has exposed to this virus, there's like practitioners coming to your home to do that. Yeah, most of the time you don't need to go to the hospital, I think. And I also heard that recently in Qingdao, that's another city in China, and there's another wave of the coronavirus, and they're basically testing like 9 million of people in 5 days, and they're all like in-home testing. You don't need to go to the hospital. Yeah.
Yeah, so the whole idea here was to control people's access to the public, really to restrict movement at all, even to get tested. So this is all part of that whole system that's been created around this. I think those are good questions, actually. And so into some initial findings.
Did you want to address David's question now or later about the relationship to COVID?
Well, we're going to do it right now. Oh. It's coming. It's because what we decided is after we started working, then our COVID alert system came into play. So we decided we couldn't ignore the COVID alert system, and gives us a chance to do some comparative work with the health code and COVID alert system. So, but out of the Chinese system first, kind of came this idea of, and from our interviews, I'll skip to next slide and then jump back. We started interviewing people in Ontario about the COVID alert. So we adjusted the study and then we started doing some snowball sampling of people who had downloaded the COVID alert app. There's lots of stuff in the media about people who aren't, downloading the app. I have mine, but we decided to interview people who had downloaded to get some richer information. So in a week, we did 16 Ontario participants. 8 from, I think around 8, John might have to correct me, from the Chinese community and some from sort of non-Chinese locals in Ontario. We're interested in their experiences of the COVID Alert app, their motivations, their expectations, their experiences, and potential improvements that they felt. We wanted to understand how this compared with the health code app in China. So just going back, one of the first things we started noticing, and we're still going, as I said, these are initial findings, we're still working. But the idea around collective care. So, you know, very early in the project, when we began interviewing people in China, people would talk about even mask wearing. And right around the time that we were hearing from our Chinese participants about mask wearing, we were getting contrasted with the dialogue and the narratives around mask wearing in Ontario. And in the Chinese case, people talked about sort of taking care of other people. So the mask wearing wasn't about their own, whether they were well or not well. It was about making sure that everybody else would be safe. And so this sort of idea of all of us in this together. Now, I told you I'm kind of against the Hofstede cultural dimensions arguments. I find it too reductive, and for me anyway, it feels very stereotypical. Maybe it's the anti-racism stuff flaring up, but I have a real issue with saying, well, this kind of culture behaves like this and another kind behaves like in some other kind of way. However, we did start to see that even in a narrative around values and how people approach the pandemic, it was quite different in China. And this spilled over into the use of the app. So the health code app is not just, I need access to the bus or to the market, but I also, I can't make everybody else sick or put everyone else at risk. So this real idea that filling out the data, the temperature data on my app is about me taking care of my family, my neighbors, and other people around me. And this really contrasts with how people in Ontario, the people that we started interviewing, see the COVID Alert app, where it's seen as I'm safe, right? Because the app, even in the language of the app, that when you get your alert, it tells you that you're okay, right? Is this a subtle difference in the way the green says, I am healthy enough to be among you, versus our green thumbs up that on the COVID Alert app says, you are okay. So it's a slight difference in a philosophy around this. And certainly it does seem to permeate the way people are treating these systems as a sort of it's about me versus it's about me and how I interact with you. So this kind of spills over into my whole system approach, thinking about people and systems, and thinking not just about the system architecture that I showed you a diagram of, but really even going further to think about the human infrastructures in these systems, right? So, you know, economists will often talk about human infrastructures as health, education, nutrition, things like that, whereas physical infrastructures are like the things we know about transport and energy and water and things like that. But the idea here that in the health code architecting, it's this huge thing that considers people, for example, elderly, the elderly and children who don't have mobile phones or have difficulty with mobile phones are considered part of a family health code. So you can actually show your health code that would cover your grandparent, your mother, and your children as well. So it's kind of like this interesting collective concept versus all of us that have our own individual devices. And in that way, it tends to reduce some of the, you know, the problems for children who don't carry cell phones or who don't have them, or elderly people who have difficulty with these complicated technologies. An idea that there's somebody who in the household who's going to take responsibility for the household on the health code scenario versus the COVID alert system. And I have a set of papers around elderly in Ontario and how mobile technology is used around people who are over 60. And I could see that COVID alert and the way that it's being implemented will miss a large part of the population, especially as they live in care homes and would have to have their own device as they are not part of a family unit. Then there's the levels of enforcement. The New York Times article talked about police. Some of the data goes to the police, right? And so this idea of serious enforcement of infringing on the health code. We have some great quotes from some of our participants who talk about, you know, there's actually a built-in fear of not complying. And this could be considered part of a sort of a regime, and, you know, and the politics of the Chinese government. And the idea of this can be enforced. So it's not an idea of whether I choose or not. It's that I must take part in this, overlaid with this idea that I'm taking care of everyone. So it's kind of mixed in. This enforcement, this care is kind of convoluted in a way, compared to the COVID alert system, where, you know, distrust of the government and, you know, actually, I don't find it a very sophisticated architecture, makes people very suspicious of our COVID alert system in our pandemic, so that a lot of people are not actually using it at all. And then we talk here about ease of use versus super app embedding. So the COVID alert system that we have in Ontario is quite easy. All of our participants so far find it very easy to download and use. There's not much you can do with it. There's not a lot of interacting with it. You get an announcement every so often. Yet maybe this hyper simplicity has made it suspicious to some users who don't believe it works. They don't believe in the data. They don't believe that the Bluetooth architecture is working. And there's no way to really find that out. So, and the other thing we found is that all users, both Chinese and Canadian users, so users in China and users in Canada, are gaming the system. So they're all finding ways to work around these systems, even with the enforcement, even with all of the ideas around care. There's always a couple people who are trying to find a way to kind of work around what they feel are constraining systems. So that's been some of what we've been working on. We are continuing to do some of the work here. As I said, we're working towards a paper that we are trying to finish by I think November, early November. Yes, he's keeping us on track. And so this will be one of the first, I think, pieces comparing the health code app in China with the COVID alert system in Ontario. Are there any questions about that before I move into the next theme, the last theme? So the question
David, did you have a follow-up on, did you have a follow-up,
yes.
David, or?
Yeah, so actually I was just typing it in, but maybe I'll ask it here. So it was more just a response to Zhao, actually, that my understanding is that so COVID alert relies on Android or Google and Apple infrastructure. And so the Apple and Google portions are being kind of forced installed on everybody's phone. That's just part of the, you know, the operating system. But the app itself that uses that, and COVID alert is just one of many global apps that will use that infrastructure. That is, to use that, you still have to, it's still voluntary to install that app. And the infrastructure is supposed to not do anything unless you have one of these apps installed. But you know, maybe that's changed.
I'm not sure it has changed, actually. I think it's very similar. So this is part of the issue around a much more patchwork implementation in terms of a whole system that goes along with all these other pieces, you know, pieces around privacy and surveillance and, you know, mandatory reporting and temperature checking and so on. So ours is not quite as locked tight. It also depends on a very different kind of architecture, but and even more interestingly, the embedding of the health code into WeChat has been really fascinating to me, versus creating a separate app for contact tracing and for demonstrating wellness from the pandemic. So that's something that we're playing with in the paper as well.
Okay. Thank you.
So Ron asked, what was the level of comfort by the Chinese citizens with the level of data collection and risks of misuse by the government? I don't, Zhao or Yasi, do you want to speak to that?
Yasi, do you want to add something to this? Because I think he did more interview on this.
Sure. Thank you, Ron, for your question. The level of comfort by, because we're doing interview studies, although we have a quite large sample, but for sure, these samples are not representative and they're not covering, like they cannot speak for the whole population. So I'm only answering on behalf of the data we have. These people, they are like, it doesn't matter how they perceive the misuse of data before in the context of COVID-19. They were willing to trading their privacy in exchange of free movement and public health, and of course, including their own health. And I think the main concern is actually not the misuse of data by the government. The main concern was, as long as the data were not leaked to someone else outside of the government, they were happier with it. I think it's the concept of like distrust of government or distrust of corporations in that. That's different.
Ron, did that answer your question?
Yeah, thank you. That was very insightful.
Thank you. Okay, so on to theme 3. And here we are focused now on online education and this sort of micro context change of in-person versus remote delivery of university instruction. And so we have, this is our sort of youngest of the themes. So we have very, very early data here as we've been focusing in other things. But one of the things I've been really interested in here is going back to my concept of cognitive representation or looking at context. For me, as we think about these micro changes in context, one of the things that I keep coming back to is that we seem to be having different ideas. So we're starting to shift our ideas about even what we do at universities, which is teach. So this in-person, the way that we have structured our ideas around in-person teaching and learning versus remote delivery of courses has affected not just sort of students, but basically the way that we conceive of how we do our work as university teachers and researchers. So this is something that I'm interested in interrogating from this idea of what does learning, and I do a lot on learning anyway in my research, but how is learning being reconceptualized in the new environment? So we have started so far with some very, very early days talking to university professors in China. And they've been reporting that they find students were more engaged and had higher attendance in the online mode than they did when they were in person. I don't know how many of you are teaching right now. I am. And I have to say that I'm starting to feel somewhat the same. I think we still have the people who don't say much and the people who hide behind a black Zoom screen. But I am seeing a lot of attendance for sure. And then some high engagement in chat. So chat as a function that didn't exist in mostly in our in-person teaching. The use of chat and people writing in and commenting and almost like live streaming in the class is something that I'm getting used to, but it's totally changed the way that I think about my instruction. So some of that is what we were starting to see happening in China as well. Early days showing something like 70% of the China-based university students reporting that they prefer remote education. I run a poll on my class. I've run it 2 weeks straight, and students are, I asked them if they miss being in class, and many do, but many more say they're just fine with being online, which is sad for me because I think I deliver much better in person. So we're interested here in looking at that we're wanting to know why this is happening, whether this is cultural, which I'm not sure I buy, but again, I'm a bit I kind of go against those ideas. Is it about the education system? So if when we start to collect the data in Canada, will we see the same things? Is it because of the way the systems are designed? Or is it really something more about changes in cognitive representations of being in a teaching learning environment that includes this sort of online set of behaviors and practices? So this is something that I'm interested in seeing as we go through as our third pillar for this study. So we're in progress with those interviews, and we're doing a survey as well. We're interested in issues of motivation, engagement, and looking at different factors in online education systems, both in China and in Ontario. And that's what you have to look forward to. In our method, we're doing the quick survey, we're doing follow-up interviews, and as I said, we're going to do a comparison. So we don't have a specific study design yet for this one. We're still working this one through, so we'd love to hear from you on this one, if you have any particular thoughts. And I just want to end going back to my making lemons out of our robot study, and really trying to talk about what kind of light the pandemic can throw on the current context. And for sure, we've been thinking about how the overall pandemic change made me reflect on what were the things from ubiquitous computing and ideas around context awareness that come forward into this new world. CARAL stands for Context Augmented Robotic Interaction Layer, and it's basically a human-robot interaction system that increasingly is being used to represent this idea of shared context. So this idea of approaching human-robot interaction by trying to give robots the ability to reason about context and adapt themselves as a machine in interactions with humans. There's some really interesting papers that I'm reading right now on this, and that will feed it back into our robot study that we are going to still do. We have reformulated it. But I'm really interested in how ideas that were old ideas from mobile media are coming up as we think about these sort of new devices. And I still question the ability of us to get to this point where we can see context awareness really blossom within AI. So I'm more of a skeptic in that way, learning the lessons from mobile media that says that these are much more complicated than we originally think of. It's okay to think of these small interaction areas, but to think whole system. One thing like the pandemic, saw us push all these different contexts and really challenge us to think differently, maybe about how we think about context awareness in AI. So that's it. Happy to take some questions now.
Great. Thanks, Rhonda. I'm going to switch off the screen sharing just so that we can see more people. There we go. Excellent. Thank you. Avery Slater, do you have a question?
Yeah, sorry, I'm having trouble finding. You can hear me, right?
Yes.
Let me try to find. I'll do it without the camera on. Where's the camera? There we go.
Oh, you see you
Hi.
now.
Thanks so much for that talk. That was really, really interesting and thought-provoking. And I want to ask you a general question that you were actually kind of getting to at the very end, because I was struck during your talk about the kind of tension between what you said at the beginning about your pre-existing research interests in contextual AI, and then this tension that over the course of your talk really emerged between, so on the one hand, machines that can register their context or environments through behavior of the user, and on the other hand, as you were explaining, devices that are used to restrict the access to environments. So we get awareness of environment, and then that is used to restrict access to environments. And that tension really fascinated me. And so I was just wondering if you had sort of even just some speculative comments about what is sort of the future of the geofence, which is like that feature from the smartwatch really stayed with me as a term.
It's apparently very attractive to parents, and I love that sort of that, you know, we saw it in the smartwatch, and we're seeing it again in the health code in a macro scale, right? This idea of control, and how controls become one of the key features in the system, and who exhibits that control. Parents to children. So we watch that power dynamic, citizens to governments, and access to communities in another system. And what we tend to do is focus on sort of the power dynamics, but I don't want us to exclude the role that the actual machines are playing here in that, right? As both the facilitators of control and of access, which is also control, right? It's all control, all control. So one of the things that I'm pretty excited about unpacking is, like, as I read Brian's work, and he talks about judgment. So this idea of, I've been primarily interested in trust in systems, or trust in machines, and with humans and machines. So this idea of how does judgment play out, right? If the access and the control is within these systems. So is it WeChat? What happens to your relationship with WeChat even? That was a basic system that you used every day that now is part and parcel of your physical environment control, acting in a way as a geofence. And the smartwatch that was, you know, my fun thing that I skipped to school with now becomes another type of control. So I'm really fascinating, exactly right, Avery, in what hides behind these terms context aware. Is also ideas around control and access, and it scales in different direction. And even back to the classroom, right? Maybe and we're gonna get some discomfort from people who are doing online or remote instruction. I keep saying online teaching, but that's wrong, Rhonda. It's online instruction. But this, or remote instruction, this idea that it's about control again, right? The professor and the student, and controlling in that environment, and the role that these technologies like Zoom and Teams and so on will play. Increasingly, students aren't listening to me when I tell them I only want them to write me on the Quarkus shell, right? Like there seems to be this floodgates of opening up and access. And I definitely would like to control some of that to save myself. But these sort of ideas permeating these three scenarios that seem different, but actually the same topic keeps coming back. So context awareness in the mobile world never really attacked these issues head on. And I think we're going to need to come back to them and to redress this as we think about human-robot interaction. Thanks, Avery.
Peter Lowen.
Yeah, thanks very much. There's just so much in this talk, which is really really interesting and compelling, and thanks very much for kind of like letting us into your laptop in the sense of kind of giving us pictures into work, a lot of work that's in progress. It's really thought provoking. I wanted to just make a comment on the third study, and hopefully it would be helpful. But what's increasingly clear to me as the more I teach is that in-class instruction really privileges some personality types over others. That it really advantages kids who are gregarious, extroverted, overconfident. You can think of all of the traits that selects on, and my own experience teaching online, and I'm teaching a big class now of 160 students, and we interact with them in all sorts of different ways online. Is it the playing field's being leveled here across personality types in interesting ways in terms of the ability of people to find other avenues to ask questions, to get into the queue, to interact with their professor. So I would be really interested in understanding how this, basically just understanding what the heterogeneity of experiences are, online versus how people were experiencing things in class or in person. Now, I don't have any suggestion for how that varies between China and Canada, but I think that, it would be really useful, certainly to me as a professor, to have someone reflect systematically on how engaging multiple platforms can actually level out the the approach between students and professors.
That's really helpful, Peter. I'm going to let Yasi say something in a second because this is her baby too. I every time we come back to this, I do remember the early days of mobile media too, where we talked a lot about this. This was a trope that came up often. The idea that online, you know, in the virtual space, different people with social anxieties and different things would be able to participate in a different kind of way. You know, having your mobile phone with you all the time. In my dissertation, my ancient history PhD dissertation, I looked at mobile phone and social network building and looked at different, how it worked for people who were on campus versus commuter students and their experiences of a space and a place with this device, acting sometimes as a barrier to interaction, sometimes as a friend. And I think what occurs to me as I hear you speak, and I'm glad you've raised that for me, is this idea of maybe it's not as simple as that. My instinct is to say the chatty students are still finding a way to get in there, right? What I'm not sure about is that the socially more restrained students, if you will, are doing better in this environment. I'm not sure. One thing I'm starting to see early studies about attention deficit. So this goes back to work I did on the tablet and tablet work with people with cognitive disabilities, including people with attention deficits and children in particular. And the way that these screens really damage their ability to focus on the germane content online. I can see it even anecdotally. Among some people who say, oh my gosh, my kids are killing it online, and others who are like, it's basically trashing everything. It's awful. So I'm really interested in this notion of attention, coming back to attention, because I think attention is actually on the spectrum of cognitive abilities that also connects to anxiety and other things too. I think they're connected, and we're going to see that connection. And I think we are going to, some people aren't going to do very well in this new world. So this idea that they're more engaged or attending more, I'm not sure if it's going to come at a cost on stress and anxiety and things like that. But Yasi, did you want to jump in?
I don't have too much to add. It's just, I think in the context of COVID-19, the online education, it's not something that everyone have a choice to do it. Everyone, like including students and teachers and even like all the institutions, they're forced to do it. So there were so many things related to it beyond personality and their mental health status, also their familiarity with technology and their household environments. Like, I think there are so many factors to in there, so it's hard to tell at this stage what are the interaction effects.
Yeah, we're still working. Yeah, that's good. But thank you for that. I think Ron asked a question on chat that I'm not sure I got to. Did I ask this? Did we ask the survey participants about social credit and how attitudes towards it affected attitudes towards health code and vice versa? Can you tell us a bit more? I'm not sure I'm following 100%. It could just be reading too quickly. Is Ron still
Yeah, so the Chinese social credit system, as I understand, basically lets you restricts access to public spaces, but rather than based on health status, based on social credit. So, I guess I'm curious, if this is, if you tested, how, something like this, which there's clearly a lot of public support for protecting everyone together, if that's like creating more support, or if people are already very supportive of social credit, and how it might, what the feedback between those two systems is, if you explored that in your surveys.
I don't think we did. Zhao, did it come up in when you were asking questions? This is an interesting point.
Yeah, this is definitely super interesting, but I don't think we got any responses related to this social credit thing. No, I don't think so.
So that's good for us to keep in mind.
Yeah, exactly.
Thank you for that comment. I can imagine that, you know, in my whole system view, there's going to be a connection, right? That would be my instinct to think that there is one.
Yeah,
Kelly had a question.
you would think it would create more support, right, for using social credit if people are like, oh, we're used to this now. Anyway,
exactly.
I'll turn it over to the next question.
Exactly. Yeah. Kelly is thanking us for the talk and is saying, asking about the University of Toronto's UCheck app, that it's not context tracing, but the self-assessment app, and if we thought about using that as a comparison. So UCheck is just sort of kicking off, and I think it's going to come up as we discuss even the university, that third pillar. We haven't included UCheck yet, but the interesting idea of overlaying UCheck on top of COVID alert systems where people have already some suspicion and some, I think it's ambivalence actually is what people are expressing around COVID, the COVID app, to see whether it affects what happens at the university with that app too. And I think since we haven't had to come back to campus in the numbers yet that we will, I think it'll become more important, and certainly we can add that into the project. I think it would be interesting to see the connection. All the public school students, absolutely. My children, I have 2 children in school, even the private school children actually, everybody, all the students are doing self-assessments. The self-assessments, that in itself is a whole other study. My daughter, who is 17, does a paper-based system. Literally, it's a piece of paper, and then we as parents need to sign and say whether or not she exhibits symptoms, and then with the change in the ruling, now sniffles are off and on, and anyway, so it's a fairly manual system at the moment for in some iterations. Some of it is app-based, but varying accounts of whether the apps are working well, which is why we're paper. My son has an app, and he uses his app, except that when the parents forget to fill out the app, the kids are filling it out on their phones and just, you know, scanning through to the schools. I'm not sure how well it's actually working. But yeah, we have a lot of self-assessments in our future.
Rhonda, I have a question for you. Again, I think this work is so important, and I'm particularly interested in the COVID, the apps, health code, thanks. Because we're seeing such different responses in parts of North America, Ontario, and China, and so I'm delighted. I'm also really happy to hear you say that you're not falling quickly for a cultural sort of a superficial cultural. Oh well, they're just a different group. So one of the things that I'm very interested, because I think you're giving a nice story about, say, the mask wearing and the way in which that's perceived as protecting of others. And I started thinking about the social norms around these activities and the visibility. So one of the things that we need in order for social norm enforcement to work is that the people in the community can see what you're doing, right? So that's what a mask, right? So if you get to a world where everybody says, shame on you for not wearing your mask, everybody can tell, right? And so and I think one of the things with the COVID alert app is like, nobody knows. I don't know how many people on this call have the COVID alert on their phone.
Can we ask quickly how many people have it?
I have it.
You see, a lot of no's.
Yeah. Jennifer put up her hand. Okay, so we could do that. And I wondered if what you have to do, let's see, did we lose Rhonda? Are you still here?
No, I'm here.
You are, okay. So you moved on my screen. All of a sudden it was Zhao where you used to be. So I thought you might have disappeared and gotten Wi-Fi'd out on us. Anyway, talking about visibility. So one of the things about having to show the app to get on the bus or into the shopping mall is that now it's a visible thing, not almost in the same way that the mask, anybody can see it, but now we've got this, we got to show it. So I wonder whether or not you found any evidence when you were talking to people of, did they have a similar sense that not using the app is kind of like violates the norm in the way that not wearing a mask violates the norm? To kind of tease out how much of the much higher uptake is coming from the fact that I mean, you did say there's a formal enforcement component to it.
Yes.
But I wonder how much of it is that, right, I mean, not too many people in our communities feel like they're going to get a finger wagging if they don't install the COVID alert app. Do people feel like they're going to get a finger wagging if they don't have the other one on, or maybe they don't have much of a choice? But...
Well, they don't have much of a choice. You know, it's sort of stay home or have your app. So there's that, but
they
there
don't,
is something.
They don't have a
Yeah.
They don't have a choice if they want to go. Yeah, because they're going to be told they can't. But that's the same here, right? Like once the store said you had to have a mask on, everybody's wearing it on the street because you can't get into the store.
But there is something about visibility, Jillian. You're right. And this has something to do with compliance. So this idea of enforcement or social norms kind of bringing the compliance around. And the better comparison, as Ron said in the chat, is that if you look at what's happening in the US, you know, there's been such a lot of political rhetoric around mask wearing, and a lot of like weirdly connecting mask wearing, you know, to choices in political candidates or something versus, you know, health. So this real, you build up a set of norms now that are tied to other things, and so this has nothing to do with compliance now. This is or enforcement. It has to do with complying with some general will. And I think that these are really interesting ideas. If the COVID alert app, I'm never asked to show it. Like no one is asking me to show it. So it's sort of this quiet secret thing that's going on. And if you want to you know, alienate yourself with your friends, you can ask them if they have it or not. And then there are always one or two people who are going to get very angry about the fact that people haven't downloaded the app. But and otherwise, you get some really sophisticated answers. We haven't yet met anyone who has gotten COVID and is dealing with the app. I'm really interested right now in interviewing someone who either had it, and we have to input the fact that we got COVID onto the app, which is different to the way it's working in China, where if you get it and you test, it goes into the system. Like you don't have a choice. So there's this weird mandatory, somewhat secret thing happening here that is tied to, I think, some bigger questions around, you know, even openness around the architecture, understanding that architecture properly. We've been digging. It's tricky to find out about the architecture for COVID alert. Like they talk about it, but try and get more information. It's hard. So it's sort of this lack of transparency around it that we would expect to see in the Chinese system in our usual suspicion. But we're seeing it here too, and I think it does affect. The visibility is a big issue.
Right. Well, that's great. Thanks so much for your talk, Rhonda. It was very stimulating and really delighted to see this work happening. And thank you, everybody, for joining. Really glad to see you. We will look forward to seeing you hopefully next week. Have a great rest of the week and weekend. Take care, everybody.
Thanks, everyone.
Bye.